The liver is a vital organ of our body which is responsible for many essential functions in the body. The liver is located in the upper right-hand portion of the abdominal cavity and beneath the diaphragm, and weighing about 1.35 kg. Liver disease, also called hepatic disease, is a general term that is used for many liver conditions. There are many kinds of liver diseases that may develop due to various reasons. Today we'll explain some of the top liver diseases. Hepatitis. Hepatitis refers to inflammation of the liver, and it can be caused by various factors, with the most common being viral infections and are known as viral hepatitis. There are different types of hepatitis viruses. Hepatitis A is a highly contagious virus and is spread mainly through contaminated food or water. It is an acute, short-term type of hepatitis that usually does not require treatment as it goes away on its own with no long-term effects. Hepatitis B transmitted through contact with infected blood, sexual contact, or from mother to child during childbirth. It can cause an acute or chronic infection. Often acute infections require no treatment and improve on their own. Some chronic infections will require treatment to help with the symptom severity. Hepatitis C is primarily spread through contact with infected blood of hepatitis C, often via sharing needles or through blood transfusions used without proper screening. This can also be acute or chronic. Chronic infections can lead to permanent liver damage in later stages, but symptoms often don't show up until this stage. Screening and testing is important if you think you may have been exposed. Hepatitis D and E less common. D requires co-infection with HBV, while E is typically spread through contaminated food and water. Fatty liver disease. Fatty liver disease is a condition in which too much fat builds up in your liver. There are two main types of this disease. Non-alcoholic fatty liver disease. NAFLD is a condition in which fat accumulates in the liver, not caused by excessive alcohol consumption. It is often associated with obesity, diabetes, and metabolic syndrome. In some cases, NAFLD can progress to non-alcoholic steatohepatitis, NASH, a more severe form of liver disease characterized by inflammation and liver cell damage. Alcoholic liver disease. Excessive alcohol consumption can lead to various liver conditions, including fatty liver, alcoholic hepatitis, and cirrhosis. The severity of these liver conditions depends on the amount and duration of alcohol consumption. Autoimmune hepatitis. Autoimmune hepatitis is a condition in which the body's immune system mistakenly attacks and damages the liver cells. The exact cause is unclear, but genetics and environmental factors may play a vital role. If left untreated, it can lead to cirrhosis and liver failure. Genetic conditions. Also called inherited diseases, these conditions are inherited from your parents. The most common genetic liver diseases are explained below. Wilson's disease. Wilson's disease is a rare genetic disorder that results in the buildup of copper in the liver and other body organs. This excess copper can lead to liver damage and many neurological problems. It is a lifelong condition that requires treatment to remove excess copper from the body. Hemochromatosis. Hemochromatosis is a typical genetic disorder in which the body absorbs and stores too much iron. Excess iron can accumulate in the liver and other organs of our body, which may lead to liver damage and other severe complications. Alpha-1 antitrypsin deficiency. Alpha-1 antitrypsin deficiency disease causes people to have too little or none at all of an important liver protein, known as alpha-1 antitrypsin. The liver is often able to produce this protein, but the disease prevents it from entering in the bloodstream. Instead, it accumulates in the liver. Cirrhosis. Cirrhosis is the scarring of the liver tissue due to long-term liver disease and inflammation. This disease is a result from viral hepatitis and other liver conditions. Cirrhosis can lead to liver failure and other complications such as portal hypertension, which can cause variceal bleeding and ascites. Liver cancer. Liver cancer can develop as a result of liver diseases, such as cirrhosis, hepatitis B or C infection, or exposure to certain toxins. Cancer is broadly described as a disease that happens when abnormal cells grow too quickly, leaving less space for normal cells. There are two types of liver cancer, primary and secondary. Primary liver cancer starts in the liver and is called hepatocellular carcinoma. Secondary liver cancer, also called metastatic liver cancer, is cancer that started somewhere else in the body and moved to the liver. It is more common than a primary. Liver diseases are key risk factors for developing liver cancer. Having cirrhosis also increases your risk of developing liver cancer. Liver failure. Liver failure are of two types, chronic and acute. Chronic liver failure usually happens when a large portion of your liver becomes damaged and is no longer able to function normally. In general, this type of liver failure is caused by any other liver diseases such as cirrhosis and occurs slowly. On the other hand, acute liver failure happens suddenly and typically as a result of poisoning or overdose. The treatment of these both liver conditions is liver transplant. These are some of the most common liver diseases, but there are many other less common conditions and liver disorders. Early diagnosis and treatment are crucial for managing and preventing the growth of liver diseases. Treatment options vary depending on the specific disease and its stage. If you suspect you have a liver problem, it's essential to consult a healthcare professional for proper evaluation and treatment.